To Dr. Srinivas for the wonderful introduction. First of all, I would like to thank Dr. Srinivas and Dr. Chitra Madam for giving me this opportunity to present this atropine for myopia control. First of all, my screen is visible.
Yes, sir. Yes. You can go ahead with the slideshow.
Yeah. So first of all, I would like to tell, like whenever you do a refraction for a child, and tell the mother that the power has increased, the first thing is that she will tell, why did the power increase? In spite of wearing glasses, the power is increasing. Is there nothing in the world to stop this one? As if you are at fault. You are the cause for this increase in the power. That is what the attitude of the mothers will be. So all these days, I had to just cut a sorry figure and say nothing. I don't have anything to offer. And unfortunately, now we have the Ramband. That's the atropine eye drops, which can control the myopia. So if you see the pandemic, before the corona pandemic, myopia pandemic was there for a long time. From 5% incidence of myopia in the world, it has almost gone to 22.9, and high myopia is about 2.7% of them. And by 2050, it is expected to go to 49.2%, and 9.8% of them will be high myopia. So Dr. Rohit will ask, what is a big deal? We all know that myopia is just not myopia, it's associated with so many degenerative retinal diseases, glaucoma, cataracts, besides the cost and this thing of the optical correction. So though we cannot stop the onset of myopia itself, we can definitely reduce the progression so that we prevent it going for the high myopia. So what are the current available modalities? There are a lot of things like the progressive glasses, contact lenses, environmental modifications, but the only thing which has been conclusively proven is the pharmacological modification. So to date, the atropine has been the only medicine which has been demonstrated to consistently be effective in slowing myopia. Initially 0.5 and 1% were used, but they were having a lot of problems with the poor near vision, and they are not able to tolerate it. And also there is an incidence of rebound myopia. Hence, the recent studies have shown that 0.01% of atropine is extremely effective in retarding the progression of myopia. It is associated with minimal side effects, and 98% of the children, they tolerate it very well, except a very few children who may have near vision problems. And also the rebound myopia is less in this concentration. So the atropine does not work through the accommodative system. It works through the specific M1, M4 receptors in the retina, and also it has a non-muscarinic effect on the scleral fibroblasts. Is there any scientific proof for this? Yes, there are a lot of articles. The most important is the ATOM study. The ATOM 1 study studied 1% atropine. However, this was found to be problematic because it causes near vision problems. And then the ATOM 2 study was done where they compared 0.5, 1, and 0.01%. And they found that 0.01% is extremely effective in controlling the progression of myopia. So what are the ocular side effects? You may see very minimal. Very rarely you see photophobia, slight blurred vision, and a local allergic response. So all these effects are very minimal, and most of the children tolerate it very well. So in conclusion, atropine is the only ray of hope in reducing the rate of progression and controlling this myopia pandemic. And it has very few side effects and very well tolerated. It can be coupled with environmental modifications such as increased outdoor activities. And I would like to conclude by saying my opponent has already conceded the defeat when he is quoted in a public paper from the Kerala Journal of Ophthalmology, where in an interview he has stated that I have been using atropine eye drops for control of myopia. Thank you.